hear from the experts who are on the front lines of this strategy, Dr. Nicole Alexander Scott and General Chris Callahan. Before I turn it over to them and ask them some questions, I just wanted to speak a bit about where we are with the state's vaccinations. And first, I want to recognize that there's been a bit of frustration on behalf of Rhode Islanders, on behalf of all of us, frankly. We all wish it could go faster. And I think you will start to see that things are going to begin to go faster in the coming weeks. And we're going to receive even more vaccine from the federal government, which will allow us to get shots in the arms of Rhode Islanders even more quickly. I did, though, want to take a minute to explain to folks what our strategy has been at the beginning and reassure you that it's actually going very well. When we began with vaccinations, our Department of Health and our vaccine task force of experts advised us that the most important thing was to distribute vaccines in a targeted way to the most vulnerable so that we could most quickly reduce hospitalizations. From day one of fighting this pandemic, our primary goal has been not to let our hospitals get overwhelmed. It is a terrible thing when hospitals are overfilled and folks can't get access to a hospital bed if they need it for COVID or un-COVID related reasons. So our strategy was to be very targeted to the most vulnerable to make sure that our hospitals were not overflowing. And I want Rhode Islanders to be reassured that on that score, we're doing incredibly well, better than Massachusetts and Connecticut, better than most states in America, and much better than the national average. So from January to February, Rhode Island saw a 46% decline in hospitalizations, compared to a 32% decline national average and 22% average decline in Massachusetts and Connecticut. So while it's disappointing for everyone, including me and the folks working so hard, to see that Rhode Island isn't where we'd like to be in terms of the speed of getting vaccinations to everyone, and we are going to put the pedal to the metal to increase that speed, I do want you to know that this was intentional, driven by expertise, which said focus on decreasing hospitalizations, and we've cut them in half in the past month and a half. So that's the good news. So now, where do we go from here? Where we go from here is investing in infrastructure so we can have more mass vaccinations of eventually everybody, and as we start now with older folks. So starting tomorrow, we'll begin vaccinating based on age group in our state-run sites. We're starting with 75 and above. So to register to be vaccinated at one of the state-run sites, if you're 75 and above, you can visit vaccinateri.org. If you can't register online or you're not comfortable registering online, just pick up the phone and call 844-930-1779. So that's starting tomorrow. Anybody 75 and above, you can go ahead and you're eligible to get vaccinated. Starting Monday, next Monday, anyone 65 and above will be able to register to get vaccinated in the same way, vaccinateri.org. The other way you can get vaccinated is through Walgreens or CVS. And if you'd like to do that, you have to visit the Walgreens or CVS websites and go ahead and sign up to get vaccinated. And then finally, the municipalities are also an excellent place to get vaccinated. Mayors and town managers are working very closely with us. And For some folks, that might be the easiest, most convenient place to go. Go to your local senior center and go ahead and get your vaccination right in town. So until now, the focus has been targeted to reduce hospitalizations. We've had excellent results. Now, the focus is speed and broader distribution. We've set a goal of doubling our daily capacity at our state-run facilities from 1,400 to 2,800 over the next few weeks. We also plan to add more state-run facilities. So right now we have 2, run primarily by the National Guard, and we're going to be ramping up from 2 to 3 to 4, et cetera. Yesterday, I had the opportunity to visit the Cranston site. It was fantastic. General Callahan and his soldiers are doing a phenomenal job. The line was flowing, the parking is free, and they have capacity to do hundreds per hour. So thank you to the people of Rhode Island for your patience and understanding. Thank you to my own team for really leaning in and doing your best on this. And then the last thing I'm going to say is the general COVID picture in Rhode Island looks very good. Our hospitalizations are dropping like a rock. Our test positivity is the lowest it's been in months, far below 5%. Extremely safe situation in schools, as it has been, very low test positivity. No backlog in testing or contact tracing. And the rate of spread, which sometimes we call R naught, is less than 1, which means for each person infected, they're infecting fewer than one other person. So listen, we have a lot of work to do, and we are going to put the pedal to the metal with vaccines. But looking at the whole picture, I hope you're reassured, as I am, that Rhode Island is in a safe, stable place with our COVID-19 response. Okay, so with that, we will now turn to the experts, and I'm going to ask a few questions. These are questions that we are receiving most frequently in my office or on our website, so hopefully this helps you and you can get some of your questions answered. The first question is for you, Dr. Alexander Scott. I just provided a brief overview of our phase 1 targeted strategy, and maybe you could just explain why the state chose to pursue that targeted strategy instead of immediately opening up for mass vaccinations as some other states have done.
Thank you, Governor. Thank you for that overview as well. You're absolutely right. Some states did open up mass vaccination sites a while ago. Every state is different, and we understood Rhode Island, what was unique to us based on our size, and based on the partnerships that we have in place. We knew that we could leverage that to take a more strategic and more targeted approach. This allowed us to really focus on our healthcare workers and our residents in our congregate settings. We are one of the states that has a larger proportion of residents in long-term care, and we all know how challenged and how hit hard our communities and nursing homes and other congregate settings have been. Nursing homes have unfortunately been the place where we have seen the vast majority of our deaths. And we know that we need a healthcare workforce so that emergency care is there when you need it. We have a healthcare system that is critical to preserve and to keep from getting overwhelmed, particularly knowing that we have identified the UK variant in Rhode Island here just this week. So we understood that our strategy was more targeted. We knew that it would take time, but we believe strongly that we have achieved the main objective of this first portion of our vaccination campaign. We planned to incrementally vaccinate more and more people based on age and high-risk conditions. And that's going to be the case going forward, done in a way that allows us to significantly accelerate vaccine distribution while continuing to have that understanding of communities that have been hardest hit also needing to get the vaccine that they need. So in achieving our objectives, getting hospitalization rates down, really preserving the lives of our most precious Rhode Islanders, although it took time, more time than any of us wanted, we now are well positioned to move to really accelerating and speeding up the rate of vaccinating at high volume. We really have to thank General Callahan and the whole National Guard team. With this high volume approach that we are activating now, we will be able to vaccinate hundreds of individuals an hour. And we needed to make sure that we had the supply to be able to do that. So we're going to move forward now in a way that allows us to maintain that and keep the equitable and strategic approach, but moving that much faster.
So if you look at the Rhode Island's drop in hospitalizations compared to other states, which aren't even close to what we're seeing, do you attribute that to the targeted approach, or do you attribute it to something else?
No, we definitely see it as being an important contributor. We're very happy to see the hospitalization numbers and how significantly they are proving, particularly when you look at the comparison to that drop in other states. It definitely suggests that we can already see the effects of vaccinating in long-term care facilities, for example. Now, we know for sure that vaccines is one part of the full package. We've been saying that since the beginning: testing, treatment, and vaccinations. They all are important contributors, but we are very pleased to have the level of decrease in our hospitalizations that, as you described earlier, far exceeds, if not doubles, the drop that we have seen in other states, particularly those states who have been graded well in terms of speed. So we know vaccination is certainly helping us here in Rhode Island. The COVID-19 vaccines are safe. They are extremely important tools in this fight against COVID-19. And with this 46% decrease in hospitalizations that we've seen, compared to 32% nationally and 22% in our neighboring states, we know that we've seen an even more significant drop among our targeted groups, which is why we focused on being targeted, specifically our healthcare workers and people in congregate settings. So we'll continue to have this be one of the three tools that we use together. We also want to continue to encourage people with washing their hands, wearing their masks, the best type of mask and most effective way they can wear that mask, and to continue to watch their distance, while also getting tested often, getting treatment when necessary, and getting vaccinated when you're eligible. With that, we will continue to see the data go in the right direction and help us overcome what we have been preparing for with the new strain arriving.
General Callahan, we announced today the new scheduling system for folks that are 75 and above at the mass vaccination sites. Can you just talk a little bit about that, about the new system, the new infrastructure, and why you think that that will increase our pace of vaccinating Rhode Islanders?
No, it's a great question, Governor, and thanks for the opportunity to kind of address our constituency. I think the bottom line here for us is that in Cranston and in the Dunk now, to just a lesser extent because we haven't been open as long, a couple things stand out right away. The team has been at work there for roughly 3 weeks or better, and so they are at a capacity, a throughput that's just been consistently sort of evaluated. They've reflected upon it, and so right now, and I think as you shared with us earlier just a few minutes ago, but I think as you witnessed yesterday, It is a pretty well-run operation. It's very customer-centric, and while we like to believe that the eligibility is simple and straightforward, and it is, we would also encourage, as you suggested earlier, for anyone who's got any type of a technical sort of hiccup to please, utilize the phone number. But for our 75-year-olds in particular, and we just kind of got off a phone call a little while ago with our municipal leaders, these environments are welcoming. I know that there may be a little bit of reticence to think about such a large-scale operation for some of our folks in that age range, but we have a tremendous amount of support both at the Dunk and at Cranston with a series of volunteers. We're multilingual. The equipment is there to support our 75-year-olds and anyone who just might need a little stability coming into the building, restrooms, providers, all the things that you might be a little self-conscious about. All those things are in play, and they're in play in a humble manner. But I think as we might expect, we're able to move at a great deal of efficiency. The approach has been honed really well. They both have really accessible parking lots. As it turns out, parking is a big deal. So there's plenty of parking for those that need to be close or for those that can walk a little bit of a distance. And we are very comfortable with the fact that, we're at about 1,400 plus or so in terms of vaccinations a day. We think very confidently that we'll be able to double it. So we're excited about the next several days to kind of warm that up, but I really feel like we're stepping in the right direction.
So as I understand it today, right now, if somebody were to go to vaccinateri.org, there's plenty of spots. If somebody were to go on a particular day and there were no spots, what do you recommend they do? Just go back the next day?
Yes, I mean, that is our recommendation, so it depends. For our 75-year-old cohort, there are options available. Many of our municipalities are still online and planning to vaccinate through mid-March in that cohort. Dr. Nicole and I and the team, quite frankly, the team are looking at some potential for infusing more immunizations into the downstream municipalities so that some of those immunizations can be given locally and at greater ease for anyone who has trouble traveling. But we would ask you to please try again. And we think that there's merit to, again, if you're maybe not technically savvy or there's some type of challenge with your access to the, the internet, and some of these things can be really tough. We just ask that you find an advocate that can maybe help you. And/or we did, as part of our call today, we know that some of our municipalities and their volunteers may be able to help as well. So yes, we'd ask you to come back online. And to get to the front of your question, hundreds of appointments available. The team would have said, yes, that was 2 hours ago. But once we got through the municipal call, and there were a lot of, head nods like, ooh, I'm on to that. So it's starting to accelerate. There's still a lot of options, and the website helps you get through which ones to take.
Yeah, no, that's why I asked the question, because
Yes,
I know earlier today it was plentiful. Just so folks in Rhode Island know, we still are receiving a certain volume every week from the federal government, and our goal is to get every dose out as fast as possible from this point forward, but it's still a limited supply. But again, it's state-run sites, CVS, Walgreens. You can go to their website, or your town or municipality. If you can't get to a computer, you don't feel comfortable with a computer, there is the phone number, 844-930-1779. So, Dr. Alexander Scott, take us through what Rhode Islanders can expect when they go online and they make an appointment at vaccinateri.org. So if they're going to come to one of our state-run facilities, which are currently in Cranston and Providence, but we're going to be expanding, what's it like? What can they expect?
Yeah, and we really encourage this particularly as we're expanding to 65 and older. You have more mobility and familiarity with going online or calling. As we're rolling out, we've done it so that we can really reach the high volume of people. And that will allow for our cities and towns to continue to focus on the 75 and older. And we want to make sure that they're not inundated and they can continue to do the great job that they've done in taking care of 75 and older, and that we're able to really have 65 and older go to vaccinateri.org. So when you go on, you'll first need to find a clinic for COVID-19 vaccination. You'll have to select COVID-19 vaccination as the service you want, and then enter a zip code to see the clinic closest to you. As we've said, the 2 state-run sites doing vaccination right now are the Dunkin' Donuts Center and Saconaset, which is in Providence. Select the site you want to go to. Then you will need to agree that you are 75 years of age or older and live, work, or go to school in Rhode Island. This is what we refer to when we say that people need to self-attest that they are eligible for vaccine. After that, there are questions about personal and contact information and health insurance for those who have it. Health history and consenting is also a part of that to receive vaccination. I'll emphasize that none of that is required, particularly to emphasize that the vaccine is available for free. After entering that information, you can search for an appointment site. It may be that there are no appointments available, especially knowing that we are early on in starting this. If that happens, don't worry. There will be additional appointments added. It's gonna take time at the very beginning, so continue to be patient, but just continue to check back and go through the process again. We're looking into ways to make it even easier for people to go through the registration process. But we'll ask for your patience as we do that. We know that we will get there. This system is used by about half of the states in the country, and as we all ramp up our vaccination, it will take a little time to sort out the kinks, but we know we will. We've done it with testing. We're able and well positioned to do it now with vaccines. I also want to share a helpful hint quickly. The system does not work very well with the Cox email server. So if you have a Cox email address, it might be a good idea to enter a text-enabled cell phone number for your contact information instead of an @cox.net email address. So that's just something to keep in mind for those that have that. We've included this information on our website too, which is c19vaccineri.org. So remember that eligible Rhode Islanders can do this for themselves, or you can have help from a friend or a relative. And you can also call 844-930-1779 for help with registration. We want to get as many slots filled as possible in our large statewide vaccination sites, the Dunkin' Donuts Center in Providence and Saconaset in Cranston.
Chris, I talk to people all the time who are, still a little anxious about this, obviously, anxious about the vaccine. Will I get sick? What's it going to be like when I show up? What do I have to do? And again, we're starting with folks 75 and above and then 65 and above. So can you just give people a little bit more of a feel of what they're going to see and expect when they actually show up at one of these mass vaccination centers?
Sure. Yeah, thanks, Govin. A great question, and we want people to be 100% comfortable. I mean, I think that what the team has done really very well has put the customer service angle on every potential aspect of the visit that you might have. As I shared with you earlier, when you go to Cranston as an example, you'll have, and this is the same, when you go to the Dunk, there will be, real live humans there to greet you, to help navigate you. It just so happens you might see a few more people in green suits in Cranston, and our Office of Healthy Aging and Rose Jones has recruited a a number of multilingual volunteers for the dunk. So there are people there to greet you. As you know, when you start and come in, you'll be assessed by a provider. That can be done, very quickly and efficiently at the table. And if you need a little bit of privacy, you get that right, right off the bat. One of the things that we would like to remind everyone is that there is no need to get there too early. So we know sometimes that people think that earlier is better, and in this case, it is not necessary. The appointments are essentially set up for every 5 minutes. So they're on a 5-minute interval, and as you can imagine, the Army team with a stopwatch figuring out how many people can get through at the same time, they've done this already. So if your appointment happens to be at 3:05, then, kind of queuing up at about a 10 to 3 is going to be perfectly fine. You're not going to miss your appointment. So earlier is good, but too early, not so much. So just please be aware of that. The other thing that we have seen, it's not necessarily funny, but you are going to have the inoculation in your arm. So we need to have access to your arm. So if you can wear something that allows you to do that in a manner that retains your privacy and doesn't require you to get, too over the top, that's going to be great. But please remember that you have essentially a 15-minute observation period. And during that observation period, the team needs to be able to look at your arm to see if there are any effects from the vaccine. So it will be a little bit more than just, having to remove a sleeve or something like that. It will be up and will be open for about 15 minutes so that we know where your inoculation was in case there's an issue. The key here, though, I think that's really important, that is hopefully will make your day, is that after you have your first vaccination, during that 15-minute period, you will be able to make your second appointment. So there are a number of observers that work in this particular area to help you. Obviously there are directions there, but they can work you through so that you can make your appointment for your second inoculation. And so when you leave, after the whole experience of, maybe 30 minutes or so, you'll feel good about, any reaction that you might have had long term. You'll feel good about the knowledge base that you have your next appointment all set up. And from a planning perspective, the team's literally pretty good at keeping it right to about 28 days from when you have your original first inoculation, at least with the Moderna. So I think we've done everything we can to this point to make people feel comfortable. And then I would just encourage you, we get a lot of feedback from people that walk through and they have an idea and it's great. So we're happy to implement any type of new angle to make the customer experience more pleasurable, for lack of a better word. We want to get you through. We want you to be comfortable, feel safe, and be able to recommend the experience to someone that you know.
Thank you. Okay, we are out of time, but I want to say thank you to both of you. I would say, again, I was yesterday at the Cranston facility, and I concur with everything Chris just said. If you're in a wheelchair, that's no problem. If you're a little lightheaded afterward, no problem. There are people there. They can get you comfortable. They're professionals. We know a lot of folks are anxious, but they know what they're doing. It's a big, clean facility, and it's incredibly professional. So we all will get back to work, making sure we get even more vaccinations out the door even more quickly. But Dr. Alexander Scott, General Callahan, thanks so much to both of you for your amazing work.